Namaste everyone, Chris here, and I wanted to talk about an issue that someone had mentioned to me, that they were having an aggravated cranial nerve. It's the 12th nerve. They had specified it, they had seen doctors, and this nerve comes out of the back of the cranium and innervates the tongue and a lot of the muscles around the tongue. So of course, if you're following me, if you're on my channel, you've heard me talk about the tongue before. And this is a simple fix. I've had this nerve aggravated on me before also, and so the trick is, I'll show you a technique, but the science of it is we're looking to engage other muscles to help the tongue relax. Anything we can do to help the tongue relax. It can even be as simple as Kichari Mudra, which I'll link below. And even a more subtler form of Kichari Mudra is just flatten the tongue, drop it back, create space above the soft palate, and start to use this as a reference for what a relaxed tongue is. We use the yoga practice to illuminate ourselves as to where are we holding tension that we weren't aware of, and so we can let that go, and then when we let that go, we can access more of our mind. Okay, so I also have a sequence, I'll link it below. It's on YouTube, a tongue relaxing sequence. It's a full workout of motions to take with the tongue inside the mouth and out of the mouth sometimes. And so fatiguing the muscle is another way to relax it. You can relax it by engaging the antagonists, or you can relax it by fatiguing it and then it will relax. I do this a lot with clenching muscles that are spazzing. You just clench it more, especially in a repetitive pulsing fashion, and that will relax it. Okay, so I'll give you two techniques actually. The first one is simply cues. There are certain cues. We want to engage platysma and the levator scapula. Platysma will bring the chin towards the throat, so it's head flexion, not neck flexion, which will bring the chin towards the sternum, but simply tucking the chin towards the hyoid bones is head flexion. So it's a flexion of the atlantocranial joint, and that's accomplished with other muscles, but platysma is a very easy one. Platysma, if you ever see people like make their kind of neck veins or whatever, or neck ligaments pop out, that's platysma. They're contracting platysma. So it's just bring the chin in. But then we want a posterior glide, because a lot of times the overactive tongue, which again, this is going back to that cranial nerve aggravation, the overactive tongue is a phenomenon of the head gliding anteriorly. So a lot of people have that posture pattern. So we want to glide it posteriorly. To assist with that, we need to tuck the chin. So tuck the chin, and then the attachment points for levator scapula, which, you know, research that muscle, just look up on Google Images, levator scapula. And so that's what we're engaging. So the two back corners of the cranium, we're just gonna imagine, you can do this laying down, or if once you've accomplished the sensation, you can just do it standing, is just the sensation of pushing back, like you were laying on the ground, back into the ground, or against a wall, back into the wall. But it's more effective if you tuck the chin first. So first you tuck the chin, then you glide the head back. Then you gently pull the armpits down, and now you can really feel any tension in the tongue and let that go and descend it all the way to the heart. So chin down, head back, armpits down, and then start to learn how to relax the tongue. And you do that with breathing and pranayama. You know, Ashtanga Primary Series Pranayama just came out. Pranayama is one of the most excellent ways to examine where you're holding tension. Okay, so the last technique, the second technique I'll show you, will be an actual elongation or stretch of the scalene muscles. The scalenes tend to get triggered when the tongue is overactive. And there's a lot of reasons for that. The scalenes help you inhale, they're secondary inhale muscles. So a lot of times they compensate for a weak diaphragm. And, you know, I'm no stranger to scalene activations. I broke my collarbone, and I have kind of a chronic issue with my neck, all from wrestling. And so lots of scalene engagement. So I'll show you how to release that, and this will also be, I'll go into more detail in this in my next product, which will come out in about a month and a half, called Pranayama. So this is an isolated muscle stretch for the scalenes. Now, understand the scalenes attached to the transverse processes of the cervical, I think 3, 4, and 5. Don't quote me on that, but one of those three, there's 3 scalene muscles, anterior, posterior, and a medial one in the middle. 2 of them attach to the first rib. They go under the collarbone and attach to the first rib there. And then 1 attaches to the spine of the scapula. So the scalenes will help you turn a little bit. There are a lot of lateral flexion, and if the head is fixed, they'll help you lift the shoulder. So we're going to do the opposite. We're going to pull down. Now we're going to utilize the reciprocal relaxation reflex. So super seminal to a lot of my therapeutic teachings is this reflex of the spine. When an agonist is engaged, the antagonist releases, or vice versa. So the scalenes are shoulder elevators. So we disengage them by engaging the shoulder depressors, which are the armpit muscles, pec major and the lats. So I'll tag that below. You should also, to do this really precisely and safely, you want to have a good understanding of how to engage serratus anterior and the lats. And so I have both of those videos on my channel. I'll link them below, and I'll just explain what I'm about to do now. Okay, so I'm going to loosen my right scalenes, I'll engage my left. So that's by taking my ear to the left shoulder, but I resist my hand, and that will help the right scalenes relax. To set it up, I'll bend my right leg, straighten the left leg, grab my right ankle with my right hand, and I want to keep my spine straight, so don't allow yourself to side bend. And if you can't reach the ankle, you just use a strap. And then I'll use my toes to walk my foot away, and that pulls my right shoulder down, keeping the spine straight. Here is where, if you had lats, if you know how to engage the lats, you would engage the lats here so that the shoulder does not internally rotate. We want to keep it in an external rotation. Otherwise, just keep the shoulder near the ground. And then with the other hand is where I would use serratus isolation to keep the chest open. Otherwise, just cactus arm with the other. So I'm walking the right foot away. That elongates the right neck. And now I will resist my hand and pull my left ear towards my left shoulder. This, you should be feeling the sensation of a stretch in the right side of your neck. The more you engage, push into the hand, the more it's not a stretch, it's more of just a elongating. We don't want to feel too much of a stretch. The scalenes aren't very big, and so we don't want to strain it too much. So again, pushing into the head, walking the foot away, and of course you do the other side. I do my short side 2 sets. My right side is my short side. And all the while, this is an excellent opportunity to relax the tongue. All of those same things I just said in point 1. Gently tuck the chin, gently push the head backwards, gently pull the armpits down, and then explore how to flatten the tongue and glide it backwards behind the soft palate. And then combine that with the scalene elongation isolation, or just a stretch, in layman's terms, a stretch. And that will greatly reduce any cranial nerve aggravation. It'll also help you relax the tongue, and it's just great for releasing the neck, which, like, I drive across the country, so I have a lot of tight neck muscles, a lot from holding the steering wheel. So I hope you found that helpful. Definitely comment below, subscribe to the channel, and look out for Pranayama, which comes out probably October. We'll say October 15th, tentative release date. Namaste.